So drugs for constipation, just the opposite of diarrhea. Can it? So as you all know that constipation, everyone understands that it is just an difficulty in defecation. Sometimes this may happen due to some psychological disorder, and apart from this, one is organic. Means there is actually some physiological, or some other anatomical problem. Okay, this is known as organic. Now, functional also, as it is mainly psychological, that can be classified into two categories. One is spastic and one is atonic. Spastic we can define as, you all know that our whole GIT, starting from the esophagus up to the rectum, it is having one regular peristaltic movement. Now, as a result of this peristaltic movement, there is easy evacuation of our GIT. Food enters through stomach from the small intestine to large intestine, then fecal matter used to get excreted. Now, because of this spastic one, the contraction is irregular and very severe, which can result in irregular movement of peristalsis, resulting in the stagnant of all the food and excretory particles. So it can result in constipation. Another one is atonic. Atonic means the contraction is less. So the contraction is so much less that it is not able to do proper evacuation. This is known as atonic constipation. Now for relieving constipation, first thing, obviously we have to treat the cause. But apart from this, sometimes when the cause is not definite, we have to treat the patient symptomatically. Now for that, we use the drugs which known as laxatives and purgatives. Now laxatives, we can say that it is having little bit low amount of defecation force. Purgatives is having more. Now laxatives it is otherwise known as aperients. It is known as drugs which cause elimination of soft but formed stools. Means it supplies more stool particles in the form of fiber or water. And it also, because of this fiber, water absorption is more, so stool becomes bulky. And purgatives or cathartic, they used to force our GIT to propulse the stool particles. It's drugs which are stronger in action than laxatives and cause more fluid evacuation. They are purgatives. Now, obviously, as you can say that purgatives, the force is more, laxatives, the force is less, but both having their own different function. They cannot be correlated. Both groups are important, depends on what kind of constipation the patient is having. This is the classification. Laxatives, it can be classified as, first is bulk forming and stool softener, then stimulant purgatives, osmotic purgatives. The bulk forming agents, these are the most commonly used laxative agents, such as dietary fiber, psyllium, ispagulla, methyl cellulose. They are basically the first line of drug in case of an constipating patient. Then there are stool softener, which softens the stool by supplying some water absorbent particle, which are docosets and liquid paraffin. Again, one classification is osmotic purgatives, such as magnesium sulfate, magnesium hydroxide, sodium sulfate, sodium phosphate, sodium potassium tartrate, lactulose, and lactidol. And then there are stimulant purgatives, such as it can be again classified into 4: diphenyl methanes, anthraquinones, 5-HT4 agonist, and prostaglandin analog. Diphenylmethane, they are these two drugs. They are basically given as an emergency purpose, such as before some abdominal procedure, or ultrasonography, or abdominal CT, abdominal X-ray. Okay. So the commonest drug which we use is bisacodyl, and also there is sodium picosulfate. This is also an important one. Anthraquinones is Sena and Cascara sagrada. 5-HT4 agonist is procainolpride, which is an prokinetic agent, and then prostaglandin analog, which is lubiprostone. Now, how the laxative works? The basic mechanism here is alteration of fluid dynamics of mucosal cells. Now, if we discuss the pathology, During any constipation, okay, there is decreased water and electrolyte absorption, which results in inhibition of sodium potassium ATPase of villus cells, resulting in structural injury. Now, what we do here is to increase water and electrolyte secretion by increased adenylyl cyclase activity in Krebs cells of villi, then increase prostaglandin synthesis and increase of NOS, means nitric oxide supplementations. Purgatives, they increase water content of the feces. So this results in osmotic or hydrophilic action. So the stool formation and also the propulsive activity increases, which again, as there is less, as there is the particles stay in the GIT, means particularly in the small intestine for lesser time. So there will be decreased net absorption of water and electrolytes. This also again stimulated by increased propulsive activity. Okay. So these are the basic mechanism of it. If you write this much also, that's enough. So coming to the different categories. What are the bulk forming agents? Bran, psyllium, aspergilla, and man-methyl cellulose. Now psyllium and aspergilla, they are the basically colloidal mucilages. Means they cannot be dissolved into water. They are usually suspended in water, and they are having very high amount of mucilage, which is and fiber. Okay, the fiber is very important for the formation of stool. That's why this has to be taken with a large amount of water. Point number one is they are not soluble in water. And also, if we taken with a less amount of water, it will be stuck in the esophagus, so which becomes very discomfort feeling, and also aspiration can happen. What to use? Number one, obviously, to prevent constipation. And this is the first line approach for simple constipation. Simple constipation means there is nothing much severe pathological involvement is there. Pathological involvement is like some, let's say, stenosis, the cause which this agent cannot be given is coming in the next slide. So what happens here, for simple constipation means the patient is not having any severe symptoms, he don't have any emergency evacuation technique. So in those cases where we can purchase some time to give the patient some symptomatic relief, this is the first line approach. Very important drug in functional constipation, then irritable bowel syndrome, which was discussed in the last class, then chronic diverticulosis, and to prevent straining at stools. This is also a pattern in the functional constipation. Where not to give? One is gut ulceration. They can induce severe injury in the GIT. So if there is already a GIT ulceration, the injury will be more severe and result in intragastric bleeding. Then gut adhesion. In case of there is any adhesion, so even if we give bulk forming agent also, the patient won't be able to defecate because there is already a traffic jam in the GIT. Cars can't pass. So that's the problem. First, we have to treat the adhesion. We have to dilute, open up the road. Then we can do the other managements. If there is stenosis, same reason. And fecal impaction. Fecal impaction is an emergency procedure. It has to be evacuated very rapidly. For that, we have to use enema and bisacodyl. Now, how they act? The mechanism, obviously, it was discussed in previous slides. So they increase the bulk of it. Bulk of the feces means they increase the volume of the fecal matter by increased water content of feces and supports bacterial growth in the colon. And if you remember your 12th biology, our fecal matter, it contains around 60 to 65% of our bacterial flora. They form the stool particles. So by these two mechanisms, they cause the defecation easier. Next is stool softeners and lubricants. Doku sets, which can be given both as oral and enema. Enema is the direct application of laxative or purgative agents through the rectal route, and liquid paraffin also this. They act on the intestinal mucosa, resulting in net water accumulation. Means they act both in the way of increased water absorption and decreased water exudation from the stomach. Then emulsifies colonic content, so it gets little bit softened, so defecation becomes easier. This is also a drug which has been which can be given in normal constipations where the symptoms are not very severe, and the target here is just to avoid straining at stools. There are some problems also. Liquid paraffin or DOSS, they are bitter, but there is chance of abdominal cramps, and sometimes it can cause hepatotoxicity. Liquid paraffin is unpalatable. Obviously, you can't. It's very unpleasant in taste, and it has to be taken in a very large amount. Sometimes they can cause foreign body granuloma if absorbed. Lipid pneumonia can happen if it is get aspirated, because they cannot be taken with water, though very less amount is required in a single dose. But number one, it has to be taken very rapidly, and and sometimes it get stuck to the esophagus and pharynx. From there, it can reach our lungs, resulting in lipid pneumonia. Absorption is hampered, so vitamin deficiency can happen. Sometimes there can be leakage through the anus, which is very uncomfortable, and delayed wound healing. Now, these are all the laxatives, which are minor actions. Then the next topic is stimulant purgatives. The basic mechanism here is the increased peristalsis by stimulating the mandatory plexus. Now, stimulation of mandatory plexus, they may be direct and may be indirect. Now, indirect here is the main mechanism of action which is involved here. They irritate the gastric mucosa, and gastric mucosa is GIT mucosa actually. And GIT mucosa has a large supply of mandatory nerve plexuses. So as because of irritation, so mandatory plexus also it will be stimulated in basic physiology. So as there is increased peristalsis, so absorption of water and electrolytes from GIT becomes less evident, and also because of this irritation, there will be secretion. There will be secretion, increased amount of secretion. So both this mechanism, they will act in the line of increased water content inside the GIT. Okay, so as a result, there is lubrication and liquefaction of stools, which is easy to evacuate. But sometimes it can cause loose motions also, which is symptomatically presented as diarrhea. And also, bisacodyl and Cascara sagrada, they act via increased nitric oxide synthesis, which also has additional properties to its peristaltic activity. That's why these two drugs are active very fast. Okay. But there are some drawbacks also, as there is increased water content inside GIT. So they will definitely cause water and electrolyte imbalance, particularly hypokalemia is more evident. Then colonic atony and after constipation means if there is a high dose we can give accidentally. So the colonic muscles, they get exhausted, so become atonic, and also which results in after constipation means after one episode of large amount of stool passing, there is again a episode of constipation. Then we have to give this purgatives. It cannot be given in term pregnancy because it stimulates gravid uterus. Obviously, because of same nerve supply, both receives mandatory nerve plexus, and the moreover in case of gravid uterus, our intestine, particularly the colon and the uterus, remains in very close proximity. So when one part is stimulates, it will obviously stimulate the other parts. And sometimes the patient may develop skin rash as an allergic phenomenon. This is a very common brand. That's why I have added this. All of you will prescribe this sometime in your clinical life. Bisacodyl. This gets activated in the intestine by deacetylation and undergoes enterohepatic circulation. So low dose also it is useful, and that's why Dalcolex or Bisacodyl, they can be given as a rectal suppository as well, which acts both locally and systemically by stimulating the parts. They mainly act on the colon and given at bedtime at a dose of 5 to 15 milligram, depends on the condition and body weight of the patient. So as a result of that, If we given at bedtime, it will take a little bit longer time. So in the early morning, the patient will take it. And if there is, if the patient receives as rectal suppository, so number one, it will act locally, and as it has enterohepatic circulation. So suppository, it will act within 20 to 40 minutes. Endocrines, they are also known as imodins. Basically, these are plant products. The two drugs which are available are Sena and Cascara Sagara, and they are very highly effective stimulant purgatives. In fact, the toxicity of Cascara, the main symptom is several episodes of loose motion, resulting in diarrhea and electrolyte imbalance. The active form is enthralled by colonic bacteria, and this is also taken at bedtime, and very low dose is required. One important stimulant purgative is castor oil, which was given previously. In early time when there is medicine is not that much of developed. It is also a plant product developed from Lucinous communis. I think you all have seen this plant somewhere in this area. So they hydrolyze into ricin acid and glycerol and taken in early morning. So within 1 to 2 hours, defecation will log. But nowadays it is having lots of side effects, so it is not given nowadays. They are mild drugs. So IBS means irritable bowel syndrome. Again, to recapitulate this, this is a functional disorder. Okay. So as a functional disorder, what happens here is, though any kind of pathological property is not present, every examination, every investigation, things will come as normal, but the patient will receive constipation because of stress or something. That all I have told you in your previous class. Now, constipation, now IBS is mainly categorized into two: constipation and diarrhea. And also there is another category in the form of both alternating episode of constipation and diarrhea. Now, in case of constipation predominant IBS, the few drugs are used. One is prucalopride, which is a 5-HT4 agonist. Also, this is known as a procainative drug. Procainative drug you have read in your during this anti-emetic drug. So, this prokinetic agents, they stimulate the normal peristaltic movements. So gastric emptying is fast, and simultaneously the propulsion of particles from small and large intestine, that also increased. And this happens by releasing more amount of acetylcholine by stimulating the intestinal 5-HT4 receptors. And lubiprostone is a prostaglandin analog. It also stimulates mucosal chloride channel, and chloride channel stimulation, they will result in increased secretion from the gastric mucosa. One is osmotic purgatives. Now, osmotic purgatives are very, very commonly used nowadays in case of the clinical practice. So they are not absorbed from intestine, they remain there, so systemic side effect is very less. The main property of them is to retain water inside GIT. So as a result, they retain water. So mechanism is from the previous ones, that stool become voluminous and lubricated. Increase fecal water content. Sometimes it can cause bowel distension. So bowel distension, it will stimulate the nerves because the body sense that the bowel is full of fecal matter, so they will cause evacuation, resulting in increased peristalsis and evacuation. The two important drugs here is glycerin and lactulose. The glycerin, all of you know that this is an carbohydrate category of drugs. The lactulose is the commonly used drugs nowadays. It depends on the patient condition and various clinical features. Dose may vary, but the usual dose is 20 gram twice daily. And lactulose is nowadays becoming the commonest given drug in case of constipation. Saline purgatives or inorganic salts. They are magnesium sulfate, otherwise known as Epsom salts, magnesium hydroxide, milk of magnesia, which is also an antacid, sodium sulfate, otherwise known as Glauber salt, sodium phosphate, and sodium potassium tartrate, which is otherwise known as Rochelle salts. Remember these names because this can be asked in your Viva exam. The magnesium sulfate actually they all act as osmotic purgatives. Osmotic purgative means they attract water, so they results in evacuation. Now, apart from this osmosis, magnesium release CCK means cholecystokinin, which is an gastric stimulant. Continue this topic is it is given in the morning with 105 to 200 ml of water. It should not be given during renal failure and CCF. Why? Because in that case there can be fluid overload in the body that may result in cardiac failure. So where it's given? It's given for bowel preparation before surgery. We can give in case of poisoning if the person ingest some poisonous material. So this sometimes can help to evacuate the poison very rapidly. So absorption becomes less. Also after anthelmintic therapy. Now, anthelmintic therapy, in case of this, what happens that here we give some drugs which kills either cysts or ovaries or the adult worms. Now, sometimes what happens, they get remains inside the stomach. Particularly happens in case of ankylostoma, then tapeworm. So in those cases, sometimes they are the organisms which remains, particularly the larger helminths. Sometimes there can be because of their degradation inside the GIT, severe allergic reaction can happen. So it's very important to expel them from GIT. Okay. So as a result of that, we give some purgative agents. So the evacuation of all those dead worms and ovas occurs. So we can prevent some allergic reaction to happen, which is known as after purge. Now, lactulose and hepatic encephalopathy. This is a very important concept. Now, in case of hepatic encephalopathy, basically all the symptom occurs because of increased ammonia content in the blood. Basically, we say that pathological term it is known as blood urea nitrogen. This occurs because our liver cannot metabolize various protein or xenobiotics, and particularly the ammonia is not neutralized by ornithine cycle. Also, there is increased amount of ammonia or nitrogen materials in our blood, which reaches the brain, causing encephalopathic symptoms. Now, osmotic-purgative is very important in the sense that in case of hepatic encephalopathy, which occurs in hepatic failure, then accumulation of resulting in accumulation of toxic substances in the blood. Now, how it works? The lactulose it metabolized in the colon by bacterial flora to lactic acid and acetic acid. So it will result as a result this lactic acid, this is an acidic material, and ammonia which reaches our intestine means the ileum is basic. This is and this reaches in the form of ileum as ammoniamide. So acid and base this will react. So as a result, it will result in insoluble ammonium compound. So absorption becomes less. Now for that, we need to give at a very high dose, at a very high frequency. This is the usual dose is 20 gram TDS, but it can be given up to 6 times in a day at a dose of 30 to 40 gram. 30 to 40 gram. Now here, one important function is that they neither get digested nor get absorbed. So if we give high dose also, there won't be the patient won't be having any systemic side effects. But as a result, they are a trapping of ammonia. So in the symptoms of encephalopathy, which is occurs basically because of increased ammonia in the blood, it gets reduced. So this is an important plus point in this. The type of stool and latency. The soft formed is 1 to 3 days interval. We used to have defecation. So there we give bulk forming, stool softener, and lactulose. They are the drug of choice. In case of semi-solid stool, 6 to 8 hours, all stimulants except castor oil. If we need watery secretion, we give it a interval of 1 to 3 hours. We can give saline purgatives or castor oil, which are very high efficacy drugs. And not to use. No. Obviously, it should not be given used in case of any undiagnosed abdominal pain or colic, or if there is vomiting. This situation can give very bad outcome because we don't know that what is inside the stomach. There may be stenosis, there may be some fecal impaction, there may be some tumor, there may be some obstruction inside the lumen. So in those cases, we should not use laxatives or purgatives. If the constipation is due to some secondary cause, means we have diagnosed something like mechanical obstruction, hypothyroidism, hypercalcemia, malignancy, few drugs like opioids, anticholinergic, oral iron, laxative abuse. Now, in those cases, as we have already defined the cause, we have to treat them. But sometimes it becomes necessary to to give something for symptomatic relief of the patient. So this becomes the judgment of the physician who is treating the patient. Purgative abused. So chronic use of purgative must be discouraged. Why? What it can happen? First point is there is high chance of electrolyte imbalance, and as the most involved electrolyte is potassium, which has direct action in the heart. So there is a high chance of development of heart failure in case of high dose of purgative abuse. Apart from this, other dangers are rupture of appendix, fluid and electrolyte imbalance, steatorrhea and malabsorption syndrome, protein losing enteropathy, and spastic colitis. They are the imminent danger of this purgative abuse. One important drug which is newly added, means recently has been approved in Indian market, is the albumin. This is an opioid mu receptor antagonist. This is given for most postoperative ileus. Ileus means after operation, sometimes there is decreased amount of decreased peristaltic movement, particularly in the ileum. So for postoperative ileus and constipation following abdominal surgery, this drug is very commonly given. And this is an important questions which will be asked in the exam or viva. Name some purgatives and classification, its mechanism of action of various drugs with its adverse effects, lactulose, the function of lactulose in hepatic encephalopathy. This will come as a short note. Various routes of administration of magnesium sulfate and uses. I mean, magnesium sulfate is such a drug which can be used in all three routes, and different routes it has different functions. For example, if we give IV, it is an anticonvulsant and antihypertensive drug. If we give orally, it is an antacid and laxative. If we give locally, this is an antiseptic agent. So this has, and it is having very different types of action depending on its route. Also, importance of onset of action of purgatives means when to give an purgative, how long it takes to beginning of the action, and depends on that how we have to counsel the patient. Also, this is important, and obviously dangers of abuse of purgatives. Now the topic is over. Now, do you have any question regarding this topic? Any part which you have not understand?